Now that you've been using your CPAP for a little while, you might have noticed air escaping around your mask where it meets your face. Or maybe you've received a warning on your machine or your machine's app telling you about your mask. Well, if that's the case, then it's probably because you have mask leak. And today, we'll be reviewing what mask leak is and how you can fix it. So what should you do if you do have mask leak? Well, there's a few steps that you can take to ensure that you minimize the mask leak as much as possible. The first is a simple check to make sure that all the connections are connected as part of the mask and that nothing is loose. So step through and ensure that first the mask cushion is connected to the mask frame, that the headgear is connected to the mask frame, that the tube is connected to the mask frame and/or cushion, and last, make sure the tube is connected to your CPAP machine. It's best to check all of these connections with the CPAP machine on, because then you can feel if air is coming out at any point, indicating there is a leak. Next, check to make sure that your mask is appropriately fitted to your face, specific to the mask model that you have. And you can do this by following the mask fitting instructions for your specific model. We've included in the video notes links to all the major masks out there with specific videos on how to fit each. Find your mask and follow the fitting instructions to ensure you have the right fit for your mask. A few tips while you're fitting your mask to make sure that you minimize the chance of leak. First is to fit the mask while lying down rather than while sitting up or standing up. This mimics what the mask is going to fit like when you're actually sleeping with it at night. So it's important to fit the mask while you are lying down. And the second piece is also to fit the mask with the machine on and blowing air. The mask will fit differently without air as opposed to when air is coming from the machine. And this will help you dial in the appropriate fit for your specific mask to make sure that you're minimizing the amount of leak there. It's important to make sure that you fitted your mask and are wearing it the right way when you go to bed, but it's also important that you put it back on the appropriate way if you happen to get up in the middle of the night. Sometimes that can be the culprit of the mask leak, is failing to put it back on the right way after you've got up to go to the bathroom or something else that's woken you up in the middle of the night. If you're still having issues with mask leak despite trying the prior steps, then there could be a few more culprits to what's going on. The first might be that you're breathing through your mouth and have the wrong mask. The reality is many people have difficulty breathing through their nose, so they also breathe through their mouth. And sometimes this occurs only at night, so it's difficult to know for sure. It can happen because of nasal congestion due to allergies, a cold, or a variety of other reasons that make it difficult to breathe through your nose. If you do breathe through your mouth at night while you sleep, then it's important that you wear the right mask or setup to account for that. Oftentimes, a full face mask is the best option. This is the type of mask that covers not only the nose, but also the mouth, thus giving you the same benefits of therapy if you're breathing through your mouth at night. Another option, if you breathe through your mouth, is to use a chin strap in combination with a nasal or nasal pillows mask. This elastic band is worn around your head and chin and helps keep your mouth shut while you sleep, so you're only breathing through your nose. And lastly, you could be having issues with leak because you have the wrong mask for you. And this could be for a variety of reasons. It could be due to the fact that you have the wrong size mask. Every mask comes in multiple different sizes, and it's an important step to make sure that you have the right fitting to the specific mask model that you use. You can often check your manufacturer's fitting instructions to provide a recommended size guide depending on your face. The second thing that could be going on is that you could have picked the wrong style of mask for your face. Every different type of CPAP mask fits different types of faces better or worse. So it could just be that the mask model you're currently using isn't a great choice for your specific face. Luckily, there's a ton of different CPAP masks out there for you to choose from, so you shouldn't have an issue finding a specific mask and model that will work for you, even if your current mask doesn't.